Dr. Gregory here from Beacon of Life. I just want to welcome you again to your neuropathy treatment protocol here at Beacon of Life and just reaffirm to you that you are doing the best possible thing you could be doing for your neuropathy. I know it's very easy to go home after you sign on to this and think to yourself, what have I done? But this is the best thing you can do. This is the premier office in the country for neuropathy treatment protocols. And so congratulations. And yes, damaged nerves do indeed heal and regenerate. Dead ones don't resurrect, but damaged ones do heal. We've known that for 13 years. So be at ease. Angiogenesis does happen. We can build new networks of blood vessels. We just need to provide the right stimulus to your body with the right amount of time and repetition. So once again, congratulations. We are very excited to see your first re-exam, how it turns out in 3 months. I want to just reiterate the equipment at home. We went through it in the office, but we wanted to give you access to a video that you can revisit as needed, okay? Also, feel free to call us if need be. Supplements. First thing, there are 3 that you will ingest, and there is 1 that's a lotion. Okay, this lotion goes on your feet, a thin film on each foot, right before bed at night. Okay, simple. You can put a sock on if you want to. If you'd rather not have a sock on, that's fine too. That's not going to affect it, don't worry. But a thin film. When you first use it, sometimes you got to pump it a few times for it to actually start coming out. Once it starts coming out, it's fine. But again, a little goes a long way with this. This contains in it something called nitric oxide, which is a molecule that's so important that the doctor who discovered it was given the Nobel Prize for that in 1998. So please don't eat this. We had a patient eating it. Just rub it on your feet, okay? That's the first one. The second one is neurooxidant. This is a capsule. You're gonna take 2 of them in the morning. If you want to take it on an empty stomach, if you want to take it with breakfast, the earlier you take it, the better, so your body benefits from it throughout the course of the day. If you find it's a little irritating on the empty stomach, just have it with your breakfast, okay? Just 2 of them in the morning. Next, this is just a glass bottle, by the way, okay? Next, we have 2 drinks. They come in a powdered form with a little scooper inside. You're gonna take 1 scoop, leveled off, and you're gonna mix it with water, most people do. You can mix it with juice. You can mix it with yogurt, with applesauce, with a smoothie. Generally, as a drink, most people will do an 8 to 12 ounces of water. If you want to dilute it more, it's not a big deal, but that's the typical, okay? If you want to do like a 4-ounce shot glass, it'll be pretty intense, the flavor, I'm sure, but most people will do a good 8 to 12 ounces. Okay, cold water, in my opinion, tastes a little bit better, but you know, whatever you prefer is fine. You want to get these in your body. You can do them pretty much at any time throughout the day. You know, if you have a preference, just get them in. There's 2 of them. This is the orange one, and then the other one is greens, okay? You want to take each of them once a day. Some people ask, can I mix them together? Absolutely, that's fine. It's just a flavor thing. Some people prefer that, some people don't prefer that. But again, at the end of the day, you just want to get it in your body. Okay, so that covers the supplements. This is about a 3-month supply. Okay, it does not last the course of the full 9 to 18 months that we recommend to get from day 1 to maximal improvement. This is meant to give you a push, an inertia push to get through those first 3 months and turn this ship around. It should last you about 3 months, okay? Any additional questions about that? Feel free to reach out to myself, to Antoinette. We'll get all your questions answered. Okay, now moving to the home equipment. It's not that important clinically which one of these you do first, but I'm gonna show you and recommend you use the light therapy first. And the only reason is you don't wanna get this wet. And this one involves the use of some water, ideally. So we'll open this up here. This is very, very simple. It looks like an iPad mini with diodes throughout, okay? These diodes are gonna be a combination of a very, very intense blast of red and infrared light therapy, medical grade, okay? This was an upgrade. We used to use a boot That was a 20-minute cycle. We've now condensed a 20-minute cycle into just 1 minute. So you're gonna get it's much more conducive to lifestyle because it takes 15 minutes less time to do, okay? It's very simple. You're literally gonna just plug it into the wall and then plug it into the device. There's a little port here, okay? And then we have a red button that once it's plugged in, turns it on. Once you turn it on, you'll see a blast of red light. You're gonna run it, it's gonna run for 1 full minute. Now the first time you use this, we recommend that you run it for 30 seconds on your body in each location, as opposed to 1 minute, just to acclimate yourself, to get used to the exposure, because it is an intense blast of red and infrared. It's not in any way uncomfortable or painful, but it's just intense from a therapeutic standpoint. Okay, so the first time you're gonna do it, try for one half of 1 minute, 30 seconds. Okay, you're gonna do the bottom of each foot. So you can place it on the floor and kind of hover your foot over it. You can have it on a couch cushion, on a mattress, on a bed. It doesn't really matter, wherever's comfortable for you. People ask, does my foot have to touch it? It doesn't have to. Probably if you hover your foot just off the edge of it, you'll probably get a little more longevity out of it because you don't have to keep wiping it down as much. But the bottom line is you want skin, not with a sock, okay? Skin just over the area. So normally a 1 minute blast on the bottom of each foot. Then you're gonna do 1 minute on the back of each calf. People will ask, what about the front of my leg? It's fine, but the back of the leg is much more vascular, it's more meaty, so to speak. So that's where you really wanna hit. So a minute on the bottom of each foot, a minute on the back of each calf, and then because the low back nerves go to the feet, 1 minute on the lower back. Remember, the very first time, 30 seconds each. We recommend that you go for 30 seconds and then stop it, press the red button, instead of just trying to hurry up and move it to the next area, so you get the full 30-second effect on each area, okay? There's that. Then we have the rebuilder. By the way, there's a booklet in here, plus you have your cheat sheet, so you can revisit this video as often as you like and call us with any questions, okay? Now the rebuilder, there's 2 ways to do it. The optimal way is to take this foot bath here and fill it with warm water up to your ankle. You like 1 foot in each side. Then you're going to take an electrolyte solution that we provide you with, and you'll just take this cap off and replace it with a spray cap. You're going to put 3 to 4 sprays in each side, okay? 3 is fine. Then everything is set. All that does is help the conductivity of the water, okay? When you run out of what we provide you with, we can provide you with more, or if you choose, you can get Epsom salts and put 1 spoon in each side and it has the same exact effect. Then you're gonna have one of these packets, so you're gonna open this up, this case, and in this case, you're gonna have a device with a port on the top, and then there's a dial. Okay, in your zipper on your other side, there's a black cable. Now your cable has a piece that inserts right into the port. Okay, it just fits right in there and you just push it in. On the other side, it branches into 2 cables and you have these electrodes on the end. Okay, now in here is a yellow packet with rubberized tips for those electrodes. These are made to go in the water. So what you're gonna do is you just literally, it's got a hole in the bottom and the electrode just literally slips right in just like that. Okay, you put both of them on and then you're gonna drop 1 in each side, okay? So this spreads a bit. You just spread it like that so you have some more slack. Drop 1 in each side with the black electrodes on. Now, they can be touching your foot in the water. They cannot be touching your foot in the water. That does not matter. You just want them in the water, okay? And then this is plugged in here, like so. And then all you're gonna do is turn this on and you can see there's a light that starts to flicker, okay? If you don't see the light flickering when you turn this on, the battery is dead. It's just a simple 9-volt battery. It can be changed, okay? There's one extra, I believe, in the case that comes. Now, if you look at the dial, you have from 1 to 8 intensity. We recommend you err on the side of safety and start at 1. Okay, so you just turn it to the 1, and it's going to run for a 28-minute cycle. You just let it run. You can watch the news, surf the internet, read a book, have a cup of coffee while this is running, okay? It's passive. You just got to be sitting there with your feet in the water, let it run. We recommend that every week or two, you up it about a half of a number. So week 2 or so, you go to 1.5. Week 3, you go to 2. It goes all the way up to 8. You don't ever really have to go past 5. You know, it won't hurt you to go past 5, but there's a small percentage of people that past number 5 will experience a little bit of a hypersensitivity reaction, and they'll just have a little bit of a discomfort afterwards. Again, most people don't experience that, and if you do, it's not harmful. There's a difference between hurt and harm, right? It's not harmful, but it might be a little uncomfortable. So to avoid that, if you just keep it at a max of 5, you'll probably avoid that altogether, okay? And that's it. Once it runs out, it'll turn off, the light will stop blinking, but make sure you click it off so you don't drain the battery unnecessarily, and then it will just have a longer life, okay? There's an alternative use for this. I just want to cover that quickly. There's a second packet in here that has adhesive pads to plug into the electrodes. So I showed you the use of these black rubberized ones. These are meant to go in the water, but you can exchange these. You just pull it off for one of these adhesive pads. It's the same thing. You're just gonna pop that right on. You peel it off the decal, pop it right on there, one on each side. Obviously, these adhesive pads are not going to go in the water. This is if you want an alternative use. Rarely we have somebody who, they have so many physical difficulties that they have some limitations, and they have trouble carrying this with water in it from the sink to then bend over and put this on the floor. Or maybe you're traveling. You know, you're taking a flight to Italy or something, and or to visit the grandkids in Florida, and so you don't want to lug this tub with you. Well, what you do then is you just take this device with the cable and the adhesive pads. The adhesive pads, they'll plug onto the electrodes here, and then you're gonna stick it right on the bottom of the foot, like the ball of the foot right in the center, okay? Below the toes, right in the center. One on each side. So you close that circuit, and you do it exactly the same way. Turn it on, whatever number you're up to at that point, 2.5, 3, 3.5, wherever you are, put it to that number and let it run the 28-minute cycle. Once you're done with the adhesive pads, take them off the cable and stick them back on the decals here, on the pad here. You'll get a much longer life out of them if you do that. And then you can just keep reusing the same pads until they've lost their adhesive nature to them, right? They're no longer sticking to your foot. Then you use the next 2 pads, right? And I believe there's 8 of them in here, so it will last you quite a long time, okay? Again, any questions about anything, reach out to us, refer to the cheat sheets, refer to the booklets you have, revisit this video as often as needed, and call us as often as you need. Once again, congratulations on starting your protocol here. We're very excited to see the results of your first re-exam.